Hello everyone again, welcome to Gulf Shore Chiropractic. We are working with one of our new patients today. I'm going to bring you right back to her, and her and Dr. Chip are going to explain a little bit about her issues that she's had for the past 2 years.
My first appointment was awesome, hence me coming back. He took a lot of care to check everything and make sure that he wasn't just focusing on the one area that I told him about in particular. He did a lot of muscle release and stretching as opposed to just going right in and cracking me. And then at the end, he put some heat on with some traction and I left feeling like I had a new back. I've been dealing with the pain for about 2.5 years and just been putting it off. So to walk out of here feeling like a new person was a really good experience.
Hi guys, thanks for joining us today. We have Katherine with us today. So Katherine is one of our newer patients. We've been treating her for the left shoulder impingement and also for the mid-thoracic pain that she's been having for 2 years. So can you tell us a little bit about how your symptoms have been?
So start with my mid-back, I notice especially when I'm sitting for an extended period of time, it just feels like a tightness over development on the right side, and it almost radiates like a heat, a painful sensation in my mid-back area, and it doesn't matter how much I stretch, I'm pretty active, it always comes back. Feel that on the daily. And then the left arm, it just always feels like it's stuck. Mm-hmm. When I lift both arms, it doesn't have quite the same range of mobility as the right arm. So since our last session, this has actually felt a lot better and a lot more even.
With more range of motion and everything. Yeah, and with the shoulder, you know, because you're a yoga instructor, so you use it all the time. So, so she knows how to stretch it out. So, but we always tell patients, you know, sometimes when a joint is not letting you, and the joint is not sitting properly, the muscles, you know, it doesn't want to react properly. So today, we're gonna actually treat her for the left shoulder first, and then we'll go to the mid back. All right? So let's have you stay where you are right there, Katherine. Can I have your left arm? I'm gonna bring this all the way up. So typically what I do with the shoulder is that with any shoulder impingement, we were trying to release the rotator cuff, you know, all right? So the first thing we'll do is bring her into abduction here, and we're gonna go into slight extension, and we actually will have her resist downward for me right there, Katherine. Good, keep going. And at the same time that she's doing some isometric, we are actually releasing a lot of the attachments from the teres, the lats, and the posterior deltoids here. And relax me. And let's bring it up a little further, Katherine. Good. Yeah. So you push down for me. Good. Keep going. Good. One more time. And relax me, Katherine. So, of course, this is what we call PNF, proprioceptive neuromuscular facilitation. So I use a bunch of soft tissue mobilization techniques. Hold and relax, contract and relax, push down for me again, in our session to really help the patients to really get a lot of the soft tissue to break up. At the same time, trying to mobilize some of the joint to release even better. Push down for me right there, Katherine, and relax for me, please, and bring her all the way up. Nice job. Good. So next thing we're going to have you do is bring this into external rotation, and we're going to have you stay right there, Katherine, and hold it right there for me. And we're also going to try to release some of the further attachment right to the parascapular region back here too. So go ahead and push forward for me right there, and relax me, please. Good, keep going, and relax. What a lot of people don't realize with any shoulder issues, particularly rotator cuff, is that the chest muscle will oftentimes get tighter. So, and the more active people are, again, a lot of people who work out with weights, and even, you know, Katherine, you know, she does a lot of where she's having to plant her arms down, so she's always firing her chest muscles. So we typically want to really have those stretch out more. You can see here, she's really stiff here. Go ahead and push forward for me. And so we're gonna try and release this as much as we can. And relax the arm for me. Good, one more time right there, Kat. And relax for me, please. Good job. All right, we're gonna bring this up again on you. And as you can see with this here, she's gonna approximate her upper arm to her ear and slowly sneak behind her head just a little bit more. So that's the range of motion that we want. So we're still not all the way to where I want her to be, but she's much more mobile than what she was. So go ahead and push downward for me. And relax me, Katherine. Nice job. So we're going to finish this with a shoulder adjustment that we're going to do for her left shoulder. So go ahead and sit up straight for me, Katherine. So I'm actually going to have you bend your elbow for me. We're going to come right behind you, and we're going to give you just straight up.
Okay.
Okay, stay right there for me, right there. Good. Good job. All right, relax for me. Good. Let's have you bring it back in for me. You can see she's going back into extension here. A little bit better. The chest opens up a little more. Good job, Katherine. All right, let's have you go face. So now we'll proceed to adjust the mid-thoracic on Katherine. Of course, this is also chronic. This has been going on for a few years on her. So again, you can see some posterior rib pumping on the right side right through here and some hypertonicity right there. So she does have a slight curvature here. So again, most of our adjustment can be rotating to the left. So first thing we'll do is, I do a lot of muscle work on patients. We're going to do some myofascial release and trigger point release on Katherine. And first thing I'm going to hit is the extensors and the rhomboids and some of the mid traps to release the shoulder blade for her. Keep breathing when you can. Good. And I am putting a lot of pressure on most of our patients. We go pretty deep on them. It's short term, but a lot of pressure is needed to release a lot of the muscles up right around the scapular region here. Good. Keep going. Good job. Let's have you raise your right arm up for me, Kat. We're going to bring this all the way back. Good job. Good. Again, resist downward for me. Perfect. Good. Keep going. Good. One more time, Kat. And relax for me, please. Good. Nice job. And again, tighten chest muscle will bring the kyphosis forward more, or the thoracic spine forward more, and which will also make the kyphosis worse, of course. So that's what I'm trying to do, is release that front side to help the thoracic spine to go back into extension better. Go ahead and push forward for me, Katherine, and relax for me, please. Nice job. All right, let's have you go forward for me, Katherine. All right, so now we're ready to actually adjust her thoracic spine for her. Go ahead and take a deep breath in right there, Katherine, and breathe out for me. My shoulders for me. Good. Nice job.
Yeah.
Good. Take another deep breath for me, Katherine, and breathe out for me. All right there, my shoulders for me. Nice job. All right, go ahead and take another deep breath in for me, and breathe out for me, please. Good. Good job. All right, awesome.